Hello, everyone. My name is Bianca Mitchell, and I am the care coordinator here at this facility. Today, I will be discussing the fundamental principles of care coordination. During this presentation, we will go over effective strategies, community resources, ethical issues, and policies that affect the coordination of care. We will go over a patient-centered approach and how to include the patient and family to improve quality care and patient outcomes. Thank you for joining me today. Care coordination is not only organizing and disseminating information in order to assist in the improvement of patient care throughout a community, but also educating patients in order to assist them in better understanding how to properly manage their medical condition. Coordination of care is a key component in the delivery of a safe and effective treatment solutions for patients. Care coordination involves several strategies that can be used to effectively include patients and family members in the process. Active listening is one of the best forms of communication any provider can give their patients and family members. An article in 2019 by Birdsong highlights why active listening is a strategy for healthcare professionals, with discussing the importance of using active listening skills to better hear, understand, and treat patients. Another effective strategy for collaboration with family members is return demonstration. Return demonstration allows for the nurse to assess the level of understanding when teaching a family member a new skill that the patient will need after the discharge process. Providing copies of printed materials is vital when going over medications and the directions on how to administer them. Prescription bottles can often be too small and not include the full directions. Therefore, patient and family members need a list that gives their complete medication list and directions. Providing a list is also essential for patients to have with them when going to follow-up appointments with providers, and makes it easier for providers to update when changes are made. Including the family and patient in the collaboration process builds rapport. Change management. Change is necessary in healthcare to help meet the needs of patients and improve quality care. Understanding the change theory process is vital in care coordination. A widely accepted change theory by Kurt Lewin breaks change down into 3 stages: unfreezing, changing, and refreezing. In an article written by Hussein et al., it was stated that what the members or employees know about the organization's products, processes, clients, and competitive situations is actually the outcome of the original learning process, which is where sharing knowledge comes in. The member inherits abilities, intuitions, and memories may be tactic knowledge, which cannot be easily conveyed, but can be found in documents, databases, and manuals. And that was in a 2018 article. Knowledge sharing of best practice with colleagues and other nurses is essential in working towards high quality, patient-centered care. Coordinated care plans based on ethical decision making. Care coordination, just like any other nursing field, are faced with ethical issues on a daily basis. The care coordinator must be able to use their knowledge of the ethical principles used in nursing to make decisions that has the patient's best interest in mind. The Nursing Code of Ethics is composed of 9 provisions and support statements developed by the American Nurses Association. These provisions are in relation to each nurse's choices, behaviors, and duties. These provisions and statements align with nurses' commitment to provide compassion and respect while delivering quality care to patients. The 4 ethical principles are defined as autonomy, beneficence, non-malfeasance, and justice. Autonomy is accepting patients' decisions regarding their care. Beneficence is doing what is best for the patient. Non-malfeasance is to do no harm, and justice is to treat all patients fairly. All of these ethical principles are applied daily when coordinating patient care. Every patient's care plan will be different, but ethical principles should be considered in every situation to achieve high quality care and outcomes. Healthcare policy provisions. There are several healthcare policies that are relevant to the care coordination process and should be taken into consideration. We need comprehensive policies that take care of the aging American seriously and fund it accordingly in a wider range of settings. And that was in a 2020 article by Werner et al. Healthcare policies has a direct effect on patient experience. The Affordable Care Act, widely known as Obamacare, was signed into law by President Barack Obama on March 23, 2010. The goal of this program was to provide affordable care for all people. It also prevented insurance companies from denying insurance to individuals with pre-existing conditions, allowing them access to quality health care to manage their conditions. The Affordable Care Act required certain preventative care to be covered at no cost to patients to help prevent late detected illnesses later at higher costs. Lastly, the Affordable Care Act expanded the Medicaid program to more individuals who qualify by implementing a higher cutoff limit for low-income families. HIPAA stands for Health Insurance Portability and Accountability Act and is a law that was passed in 1996 that created standards to protect patient-sensitive information and prohibit disclosure without the patient's informed consent. HIPAA is composed of 3 rules, including the privacy rule that limits disclosure and limits information shared, the security rule that protects electronic health records or electronically transmitted information, and the breach notification rule that requires affected individuals and or even the media to be notified if there has been a breach in sensitive information. Taking these healthcare policies into consideration with patient satisfaction, patients should feel more at ease knowing their personal and private information is protected through HIPAA. Also, with patients going through life changes such as termination from a job or switching to Medicare, they will feel reassured that they will still be able to receive healthcare coverage even with pre-existing conditions. Healthcare policies like the ones mentioned should have a positive effect on the patient's experience. Continuum of care and nurses' vital role. The care coordination team can include several members, including but not limited to the care coordinator, case manager, social worker, primary nurse, therapist, doctor, and of course, patient and or family members. Nurses provide care coordination by organizing and sharing information to help improve patient care through a community, as well as providing education to help patients understand how to effectively manage their medical condition. Nurses are vital to the care coordination process by providing a holistic approach to meeting patients' needs through education, collaboration, and providing resources. Nurses will use social determinants of health assessments to determine patients' needs and community resource referrals, which could include Meals on Wheels, Council on Aging, the Health Department, American Heart, shelters, and many others. Nurses are the forefront when it comes to care coordination. Conclusion. It is the responsibility of nurses, case managers, social workers, advanced providers, and physicians to ensure the safety and best practice measures are implemented while coordinating patient care. Care coordination is often referred to as care management. Care coordination is essential to providing safe and best practices strategies for patient care. Thank you for listening.